Hi, my name is Martine. I'm the Youth Services Business Support Manager and Project Lead here at Hammersmith, Fulham, Ealing and Hounslow Mind. Our organisation implemented iaptus in late 2018 when it was confirmed that we would be hosting the mental health support team services here as a charity organisation partnered with NHS. It was really imperative to get a system that was able to link us up to the SDS cloud so that we're able to flow data seamlessly. It was also really helpful to have something that the whole team could use to monitor ourselves internally, really helped with more joint up working for the teams, which is really important when you're implementing a new team, making sure that we're working together, there's clear communication between the teams, and easy working for everybody. One of the problems we were identifying more anecdotally than anything else with health inequalities was that a lot of marginalized communities were not accessing early intervention help, but show up later on in the service for more acute issues, especially with their mental health. What we found was that being a community charity service, it was easier to engage with marginalized communities, but of course, we're always fighting stigma within those communities around accessing early intervention mental health. It was really important to us to gather qualitative data and not just the anecdotal evidence that we get when we're working with children and young people. So having a system that we're able to identify and spot trends within communities based on things like ethnicity, location, etc., is able to help us make cases for perhaps more targeted projects, more targeted services that is helping those individuals more directly. We rely heavily on demographic information. So mainly that would be GP location, their own location, so their house address, maybe their school address as well. We also rely on the disabilities marker there. So we're able to identify young people that have disabilities, whether that be more SEND or whether that be more physical. We also rely quite heavily on the ethnicities. It's really helping us to see our area in terms of the different communities that we work with and that live here and how many of them are actually engaging in our services. When looking for publicly available data, we try to stay on reliable sources. So definitely NHS England, NHS Digital. We also try to use data or refer to data from other charities or organizations that work with young people, like Young Minds. We also do a lot of by-borough work with a lot of our neighbouring services. So we're also able to tap in to the data that's coming from them when we do our by-borough meetings and things such as that. So the data that we collected was incredibly interesting and was able to give sort of flesh to a lot of the things we were seeing anecdotally. We found that even though we live in a predominantly Asian community in a lot of our boroughs, they weren't really engaging in our services. So one of the things that we did is we created a project called Chai and Chat, where we specifically targeted Asian parents and young people to open up conversations about mental health. Another thing we noticed was there was a lack of early intervention opportunities or engagement from young Black boys. And it's quite interesting to see that they show up a lot more in the system later on, whether that be in prison or acute services, but they're not quite engaging in our early intervention services. In response to that, we set up a Black Boys project where we took Black young people in our community and helped to open up communication about mental health topics, to break down stigma, and to encourage them to seek help more early on in their journey. Another thing we did was look more closely at the different boroughs that we're covering. So we are Hammersmith, Fulham, Ealing and Hounslow Mind. We're covering 4 boroughs. And what we noticed is that at some points there was a lot more delivery in some areas and maybe not in others. That really helped us to flesh out our offer amongst all of our communities to make sure that we are equally responding to the needs. Having seen all of the young people that were engaging with our services with disabilities, mainly SEND, we were able to identify that we did have quite a lot of young people coming through with SEND and maybe learning disabilities and other disabilities, which helped us make the case to integrate software with our team so that we're able to create resources and handouts that are SEND friendly, easy to read. As part of my role and alongside other data officers within the team, we put together a large dashboard, which really helped us identify performance within the team. It helped us to identify the types of young people we were seeing. It helped us to identify the areas we were working in and helped us to look at trends within our communities and think about what we could actually do, what we might be able to put in place to assist and help delivery. And also, it really helped us to think about outcomes. So, how is the work that we're affecting helping the young people? All within one dashboard to make it really clear and concise and to easily shareable with the rest of the team. I think there's been a great impact on the children and young people that we've been working with. Having a more concise system and making delivery a lot easier has really helped in the amount of young people we're able to see, which has helped our numbers increase. It's also helped our outcomes get better. More people that are seeing us are actually improving in some of the signs, the key indicators of their mental health. Young people are also actually getting more involved in the projects that we're putting on here as a community. It's really helped to, I guess, inspire conversations around mental health, break down stigma, and get them involved in actually shaping what mental health services they want to see in their community. So it's been really great.